Welcome to the Engage Jeffco Podcast, where we explore the people, priorities, and stories shaping life here in Jefferson County. I'm Amber.
And I'm Johnny. Whether you're a longtime resident or just getting to know the area, this podcast is here to help you stay informed, connected, and engaged in your community.
In this episode, we're talking about something that continues to affect families across Jefferson County, opioid use, and the ongoing effort to support prevention, treatment, and recovery.
We're joined by Dr. Chelsea Shore-Miller, Program Manager for the Gateway to the Rockies Opioid Council. Dr. Chelsea shares how this regional coalition is bringing together partners from across the health, public safety, and recovery sectors to address the opioid crisis with a united front.
This conversation highlights both the complexity of the issue along with local innovation and compassion-driven solutions.
Whether you've been personally impacted or simply just want to be part of a healthier, more informed community, this conversation is worth hearing.
Let's get into it. We're sitting down today with Dr. Chelsea Shore-Miller, Program Manager at the Gateway to the Rockies Opioid Council. Thank you for sitting down with us, Dr. Chelsea.
Yes, I'm so excited to be here.
So can you first tell us what is the Gateway to the Rockies Opioid Council and give us just a quick history?
Yes, so the National Opioid Settlement finalized in 2021, and it was a series of lawsuits against the manufacturers and distributors of opioids like Vicodin and Oxycontin for aggressively and falsely marketing them as non-addictive. It's somewhere in the ballpark of $45 billion over 18 years, and the money was divided across all of the United States. Colorado designated 19 regional opioid abatement councils, referred to as ROACs, and we are Region 10, so we are Jefferson, Gilpin, and Clear Creek counties.
And what is your role within GROC?
Yeah, so I joined GROC in October of 2024 as a full-time dedicated program manager. I handle all of the council's facilitation, like agenda setting, facilitating meetings. I actually developed the first standard operating procedures manual for all of the ROACs in Region 10, and that is a strategic framework for how the council does business, what funding mechanisms we choose and why, how we handle conflicts of interest, what our strategic plan is. And then I also do things like designing our requests for applications, the application prompts, the review process, handle communications with community members and applicants, and then do all of the post-award implementation support.
So who are the members of GROC and what are their roles within the advisory council?
So GROC is split up into three main groups. The first group is a 16-member voting council that includes one rotating city representative per county, one public health representative per county, one human services representative per county, one law enforcement representative per county, one county commissioner from each county, and then one municipal or county court system representative that has to be agreed upon by all three counties. Then within that 16-member voting council is the executive committee. There's 7 individuals on the executive committee, and they were established to conduct more granular oversight, ensuring that full council meetings remain focused and outcome-driven. The current delegation authority is narrowly scoped, primarily function to streamline the agenda items, do preliminary review of applications or a more in-depth review of applicants, approve things like zero additional cost contract extension. The third group is the advisory council. There's 3 groups within the advisory council. Unfortunately, they don't have any voting power, but they can make strong recommendations to the voting members, serving as public comment. So within the advisory committee, the 2 that are mandated by the National Opioid Settlement are the non-discretionary and the discretionary members. Non-discretionary members opt in. They're guaranteed a seat. These are representatives from school districts or fire districts within your region. And then the discretionary group would be like our substance use practitioners, addiction professionals, peer recovery coaches. parents who were affected from children suffering addiction, they can serve on the advisory council. Then the final group is special to Region 10, and that would be all of our grantees have a spot to be public comment.
So, how often does GROC meet, and what are the goals of these meetings?
So the full council convenes once a month, typically the fourth Monday of the month. Unless we have holidays, then we move that to the second Monday of the month. The executive committee meets the first Monday of the month. Anybody can join any of our meetings. They're all publicly open. They're all recorded and posted to our YouTube channel. The purpose of each meeting is dependent on where we're at within our strategic plan. So the last 4 months, we've been focused on requests for applications and reviewing funding opportunities, just making decisions on that. Our August meeting, our next meeting that's coming up, will be more policy focused, going over some revisions to our standard operating procedures manual, talking about contracting with some of our grantees. It really just depends where we're at in the year.
So, can you talk about the 8 newly announced initiatives and the 2 renewed initiatives within GROC?
Yes, this is super exciting. So, we are proud to announce the launch of 8 new innovative initiatives and 2 renewed initiatives aimed at addressing the pressing needs of individuals struggling with substance use disorder. It totals to about $6 million in new contracts. So our first one would be Denver Recovery Group. They are based in Lakewood. They were approved for a little over $100,000 to extend the hours of their MAT facility, medicated assisted treatment facility. The second one is Jefferson County Public Health. This is a harm reduction initiative that was approved for a little over $1.5 million. They will be extending their street team work that they already do in Jefferson County into Gilpin and Clear Creek counties. We also have Resilience 1220. This is a youth prevention organization based in Evergreen, which is rural Jefferson County. They were funded to extend their work into Gilpin and Clear Creek counties. They offer free therapy services to youth, including a bunch of pro-social events that focus on non-substance use, emotional monitoring, and positive peer support. Recovery Works is a Jefferson County-based organization focused on the unhoused population. They received funding specifically for staffing to continue their MAT, medicated assisted treatment program, for the unhoused population. We also have the Jefferson County Sheriff's Office that was awarded funding for biometric monitoring systems to support people who are entering incarceration and might be experiencing substance use withdrawals. So these real-time wearable technology will help support their MAT staff and nursing staff catching overdoses or withdrawal crisis at an earlier response rate. Gilpin County Parks and Rec was funded for their youth prevention program to extend into their second school district. And they offer a bunch of life skills training classes, substance use prevention training classes. Their biggest purchase is a van so that they can recruit more students who don't have transportation in the rural mountain regions. The City of Lakewood Police Department was funded to transition their co-response unit from out-of-house contracting to completely in-house within the police department. And while co-response was not part of this year's strategic plan for GROC, the council thought investing in them for 2 years would create a sustainable long-term impact in co-response. We also have Monarch Recovery Services. They are running a women's sober living home in Wheat Ridge, and the owner was going to sell the house. The owner agreed to sell directly to Monarch so that they could continue the sober living program. All of those women would have uninterrupted care, and that is what we did. We are purchasing a home so women sober living can continue. It's the biggest investment. It's a huge capital purchase. Kaylee, who runs Monarch, was awesome to work with, negotiating with the council on how we think of things like equity, if the contract were to end early, how many people do they need to serve for us to break even on the capital purchase. She was super flexible, which I think the council was really willing to take the risk and purchase a home. Sober living is guaranteed to continue offering support to people. Our two renewed applications are going to be Advocates for Recovery Colorado. So they were funded in the first round to extend peer recovery coaching services in all 3 counties. That includes a dedicated program manager who's on the ground organizing social events, doing face-to-face peer recovery coaching. And then it also includes a regional program manager who does more of the administration, grant management. They are a well-established organization all throughout Colorado, so we're super excited to have them doing their work in Region 10. The other organization is Clear Creek Community Crisis and Health Assistance Team, or CHAT. This is based in Clear Creek. They are a co-response program. They are the perfect example of what's called a seed grant. The GROC invested a lot of money in the first year to start this program and start collecting data of what are the needs on the ground in vulnerable populations. Elizabeth, who runs the program, collects amazing data. And so we were able to fund them for 2 more years while they work to get this program sustained through county funding. So that's a seed grant. We give them the initial startup money, and then the community finds it beneficial that they find other ways to keep it funding.
Can you share some statistics and give us some insight into what we're dealing with regarding the opioid crisis, treatment, and recovery within Jefferson County?
This is a question that's very prominent even at the state level, is how do we collect data, especially related specifically to opioid use and opioid use disorder. There's a lot of data suppression with the rural areas in Colorado combined with metro areas. And so when the GROC first started related to opioid use disorder, the data that they had available was from 2019 to 2021, and it was roughly 76 individuals per 100,000 were experiencing some type of opioid-related crisis, including overdose or death. So the CDC did publish a brief called Drug Overdose Deaths in the United States, 2001 to 2021, that described Jefferson County also experiencing a rise in fentanyl-related crises, overdose, or deaths, very similar to national statistics. The Colorado State Epidemiological Outcomes Work Group, also known as CWO, created health statistic regions, and Jefferson County is its own region, which is beneficial for us to understand this question. Comparisons for youth substance use was pretty close to the state average. So for example, in Jefferson County, there was 14.1% of youth engaged in cannabis use, where 13.3% of youth across the state of Colorado engaged in cannabis use. When you looked at adult trends, it was extremely varied across binge drinking, vaping, cigarette use, and cannabis use. I think the most relevant to the opioid conversation is that cannabis use, where adults in Jefferson County, there's 22% who engaged in cannabis use, but only 19% of Colorado adults engaged in substance use. So some variability there. Jefferson County does tend to be a little bit higher in those substance opioid use because we are so densely populated.
Oh.
There is a very strong moral paradigm towards substance use, meaning youth specifically perceive adults, whether that's their teachers or their parents, would think of them as being bad if they used substances. So when you talk about paradigms of addiction, you can also look at the disease or medical model where someone is constantly taking opioids and it changes the chemistry in their brain. They become dependent on it. We're looking at a social paradigm. So people are drinking in public settings, or they only use certain substances around certain groups. And then you can also look at it from an identity paradigm. So I think that's also really interesting, is that heavy moral paradigm of if you use drugs, you're bad, when substance use is so much more complex than that.
Can you describe that complexity for people who may not know or understand if they have someone that they're working to help or dealing with opioid abuse?
Yeah, so addiction, again, being complex, has that disease medical model, has social components to it, identity components to it, and it's substance use is more often than not the outcome of other issues. So that could be mental health, relationship trauma. When we talk about traumas that lead to substance use, we tend to think of very big traumas. We tend to overlook a series of micro traumas, like getting our heart broken for the first time, or not getting into the college of our dreams, or a date that we thought went well went bad. And so all of those little micro traumas add up. And if you don't have coping skills and a strong sense of self identity, that could unknowingly lead into addiction. And so from there, you also have to look at recovery and recovery science, which is a new growing field, looking at indicators of recovery. Do you have a strong support system, a strong sense of identity and morals? Do you even know what morals are? Are you really connected to your work? Do you enjoy your work? Do you have purpose and intention every day? What kind of hobbies do you do? So really looking at your life from a holistic, multidimensional space, and where are you well in each one of those spaces, but also where are you unwell in each one of those spaces. That's easy to say when you have a stable job and you have a home and you have a family. We're in a very uncertain political climate with a lot of changes to community health programs. And so that creates a lot of pressure for people. And if they don't have access, or they don't have an understanding of navigational capital to access programs to provide support, that can also lead into substance misuse, substance use, substance use habits.
So, what are some of the positive impacts and success stories from the work that GROC has done within Jefferson County?
I think it's really important before you answer that question to remember the timeline of GROC. So the National Opioid Settlement finalized in 2021, and then the councils were created roughly around 2022. 2023, they're still working on policies and structure. They're still trying to wait for guidance from the state. Then in 2024, the GROC did its first round of funding. I joined GROC at the end of that round. Most of those contracts will be ending soon. I think the initial funding cycle underscored the importance of critical self-reflection for the council. A key lesson was recognizing the lack of a dedicated program manager, because that created gaps in grantee support and data coordination, which impacted implementation timelines and ultimately reporting consistencies and success. The council proactively addressed this by prioritizing structural improvements, which led to the creation of my role as the program manager. And since then, we focused on streamlining communication with grantees, strengthening reporting frameworks, and fostering collaboration across the council to ensure accountability and alignment with GROC. So that impact is coming. I can say anecdotally, we are one of the fastest growing councils in terms of our advisory board, engagement. Jefferson County has received roughly $5 million in funding across 8 different organizations. And so we should start to see that impact over the next year or two.
Why is GROC so important to the community?
GROC has really taken a comprehensive approach at addressing the opioid epidemic, ensuring that it doesn't focus on one part of the continuum like treatment. It really wants to fund programs across the continuum simultaneously to support streamlining care. So it has prevention, it has intervention, treatment, recovery, all together. It's engaging law enforcement with those soft handoffs to programs like Recovery Works, Denver Recovery Groups, Jefferson County Public Health, so that people don't get stuck in their addiction of not knowing where to go next or who they can go to. So it's, again, GROC has taken that holistic approach at looking at the whole picture, not just trying to solve one area and creating a bigger hole after people get out of treatment, or if people are in recovery, and how do they find the recovery support system, ensuring that all of the grantees collaborate and network and send referrals together. That way, again, it's just full encompassed care.
So, do you want to share any final thoughts or anything else you'd like to highlight around GROC and the work they're doing?
Yes, this falls slightly outside of my direct purview, but it's pertinent to today's conversation in Jefferson County, is in the National Opioid Settlement. individual counties can opt in or opt out of their share of money to the regional council. Most counties do opt their share into the regional council because when you pull money, you make dollars go further, you can do bigger programs. But Jefferson County did elect to partially opt out and keep some of their money. So there is a Jefferson County Opioid Task Force that meets virtually bi-monthly to develop a strategic plan to propose to the Board of County Commissioners. And then the Board of County Commissioners will decide if they want to do open requests for applications, if they want to dedicate money in-house to different departments, again, like Jefferson County Public Health, who's doing that much needed work. So there is a lot of work between the counties and the regional councils, ensuring that we don't duplicate efforts of funding, that we're sharing resources, sharing information, and again, just making sure that the whole community is getting served.
Well, thank you so much, Dr. Chelsea, for sitting down with us and sharing your insight and all the great things that GROC is doing throughout the region.
Thank you so much, Anne, for having me. This was exciting.
A big thank you to Dr. Chelsea Shore Miller for sharing her time, experience, and insight, and for the critical work she's doing through the Gateway to the Rockies Opioid Council.
As we heard today, addressing the opioid crisis isn't just about reacting to emergencies. It's about prevention, education, and building strong networks of support and care.
If you want to learn more about GROC, head to gatewaytotherockiesopioidcouncil.org.
And we'd love to hear from you. Have an idea for a future episode? Know someone making a difference in the community? Let us know. You can find us on social or through our website, www.jeffco.us.
Engage Jeffco is also a monthly newsletter. You can subscribe using the link in the show notes and follow us on social to stay up to date on what's happening around the county.
And if you found this episode meaningful, please give us a 5-star rating on Apple Podcasts and share it with someone who might benefit from the conversation.
Thanks again for listening.
Take care and look out for one another, Jeffco.